So we like to talk to you guys about smoking. We're not only going to ask you if you smoke, but how much do you smoke in terms of packs, how long you've been smoking, and what exactly you smoke. Smoking has been attributed to quite a few diseases. The three most concerning are heart disease, cancer, and lung disease. But when it comes to cancer, lung cancer is the one that's the worst. Patients who smoke are most at risk of developing lung cancer, and it is one of the most common cancers in the country. So the question comes down to is this: if you're smoking, how can you get yourself checked for lung cancer? Hi, I'm Dr. Naznin Jamal. I'm a board-certified internal medicine physician, and my goal is to empower you with basic knowledge about diseases and simple medical concepts. So let's begin. Current research shows that a computed tomography scan, also known as a CAT scan or CT for short, is best suited for finding lung cancer in people. It is far better than a chest x-ray, which is good for showing the skeleton of your chest. It can show you the shape of your heart, whether it's enlarged or not. It can show you whether there's fluid or infection, but it's not very good at detecting lung cancer in early forms. A CT scan is what's best, and it operates by developing these very thin, several millimeter thick slices of the body part in question. It also enables a radiologist to determine if there's an abnormality present. What physicians have to do is determine whether or not patients are eligible for getting a lung CT scan if they smoke. The doctor needs to determine your pack years. It's really easy to compute. So you take the number of packs of cigarettes you smoke per day, and then you multiply it by the number of years you've been smoking. So let's say, for example, you smoke 1 pack per day and you've been smoking for 20 years. That's 20 pack years. Or you smoke 2 packs per day and you've been smoking for 15 years, but you quit 5 years ago. Your pack year history is 30 years. So then you need to be between the ages of 55 and 75, and you need to be smoking currently or have quit within the last 15 years. So you have to satisfy these criteria. You have to be between. Now, let's say you're outside this age group, okay? You're between 50 and 80, and you smoked 20 pack years, past or present. And then you may still be eligible for a CT scan. Ask your doctor about your individual risk. If you've developed new symptoms such as shortness of breath, coughing, hoarseness, having new phlegm production, coughing up blood, chest pain or pressure and tightness, new symptoms with swallowing, you need to go see your doctor to have them evaluate the symptoms. These symptoms can be present in lung cancer, but they're present in many other diseases as well, and you would need a workup to determine what path or process is going on. Now, if you've smoked less than 20 pack years, or you're under the age of 50, or you're over the age of 80, then your risk of developing lung cancer is significantly less. Talk with your doctor at your next annual exam if you need to be concerned and what your risk is. It's important to note that if you decide to go through the CT scan, your doctor will be consulting with other doctors, including a radiologist or an interventional radiologist and a pulmonologist. If you go through a biopsy, then they will be consulting with a pathologist. Now, a biopsy is where they'll put a needle into the area of question and sample for tissue, which is later sent to the pathologist. Anything can be found on the CT scan. You could have anything from normal or not normal lungs to benign, which means non-harmful, all the way to a lesion or abnormality that has to be biopsied. The doctor that orders the test will discuss those with you. Now, if you end up having a minor abnormality or lesion, the radiologist will give clear recommendations to your doctor who's ordering the test about when to do the next CT scan and when to do a biopsy. Now, it's also important to remember that if you're at this point in your life where you don't want to go through a lung biopsy, you don't want to determine or find out if you have cancer, then that also be discussed. Go to your doctor and discuss with them your goals of care and ensure that there's an understanding that is clear by your physician, your doctor, you, and your loved ones. And then finally, if you're smoking, you've got to stop. Research shows that there are numerous benefits that former smokers report, and no age is too late to quit smoking and notice a beneficial life. Until next time.